recently wrote an investigative story on how the Harvard-affiliated Brigham Hospital helped China's Evergrande create an international hospital. Could you start from telling us what kind of reputation Brigham has in medical world and how Evergrande got connected with Brigham?
So Brigham has a great reputation here in the U.S. As a hospital and as a research facility. I mean, it's one of the, Boston here is, famous for all its hospitals, and Brigham is among the top here. So one of the things that China Evergrande Group was trying to do in China was to start a healthcare program and launch a healthcare initiative and build hospitals. And so they tapped into Brigham here to help them build a hospital in Hainan province. The connection happened, interestingly enough, with there was a math professor at Harvard, Xingtang Yao, who's a very famous math professor, won the Nobel, almost like the Nobel Prize of Mathematics, the Fields Medal. And he had connected with the chairman of the Evergrande Group in China. The professor is quite a big fundraiser, and he had gotten the chairman of Evergrande to help him with one of his math contests in China, and then introduced him to Harvard. And the Evergrande Group gave a big donation to Harvard. Harvard wouldn't say how much, but Professor Yao said it was about $200 million to Harvard. So around that same time, the money went to the 3 centers at Harvard, including one connected with the Brigham. And then that's how Brigham got involved in, that's how we believe Brigham got involved in the hospital project in China.
Could you tell us about what kind of hospital they originally planned to build? Who are their target customers, and what are the reasons that it failed?
I think the hope was that it would be a cancer hospital, and that patients, wealthy patients from mainland China, from Hong Kong, from Vietnam, just all the countries around there too, would come and get treatment at this hospital. But it was located in in Hainan Island, and then even on Hainan, it was located in this part called Boao, a town which is very rural, which was rural, and it was basically fishing villages and farmland that was converted into this big medical complex. And so travel there is very difficult. It's hard to get there from mainland China. You have to take multiple modes of transportation, fly there, and then take a train or take a car to get to the hospital. So it's a difficult place to get to. So even though it had the Brigham name and this kind of connection to a very top American hospital, for cancer patients, one analyst said, do you want to be a cancer patient? Do you want to travel that far to get treatment? Isn't it easier if you live in Shanghai, to just go to hospital in Shanghai if you have an option there? So because of that, I think the location made it very difficult to get to, and I think not a lot of patients came. So it ended up being a very underused facility. And because they were targeting wealthy patients, even on the local patients in Hainan couldn't afford some of the treatments. So it became difficult to kind of manage the financial balance of the hospital.
How expensive could the treatments?
The prices ranged from what we saw, for some of the more expensive consultative treatments, it could go in several, like $1,000 plus. It's a difficult match if you don't make a lot of money to get treatment there. And initially it was geared towards more private pay patients, so those who were not on the government health insurance.
What exactly was the contribution and duties, and what was the gain for Brigham Health? What kind of financial benefits could Brigham get from Evergrande?
Brigham would not say exactly what their financial benefits were, but they said it was less than 1% of their annual revenues, but that could be anywhere from $27 million to $33 million a year for the first 3 years. So it's a decent amount of money for any hospital. Is money that the Brigham felt that it wanted and needed. They said that the money helps them do other things here locally and serve the local community. The Brigham's revenues are in the billions, so 1% or less than 1% is a small amount, but when you're dealing with such big numbers, it can be a lot of money.
So this international hospital was intended as a kind of medical tourism project, combined even with golf, and the target group were rich people. There are actually some examples of successful medical tourism projects, right? Is this one less successful, not due to the failure with the whole Evergrande company, but more because of Chinese patients prefer to get medical services close to their home?
Yes, I think that's part of it. The Brigham and Dana-Farber said that, that the Evergrande had delivered on what they were required to do. We haven't been able to see the contracts, or they haven't given us a lot of detail about what the expectations were for the project and the deliverables in the contract. But it does seem like, we spoke to one doctor who said it's understandable that patients want to be treated close to home, especially cancer patients. There's a lot involved in that. So it seems like the location made it very difficult, and not just for patients, but for the doctors too. It was hard to recruit a lot of doctors to come and work there. And then if one of the problems is that, for doctors who are dealing with these specialized care, they need to keep up their skills and practice very frequently. And so if you don't have a lot of patients, you're not practicing your skills. And so that made it difficult to bring doctors to come and work at the hospital too.
Please give us a summary about what kind of company Evergrande is, according to your research. At the beginning, was it like a match made in heaven, perhaps, a fast-growing Chinese company and the top university in the world?
Yes, I think Evergrande was this big real estate company. It seemed like it was developing, buildings and projects everywhere in China. I think, we've seen maps of where their projects are, and they're across the country. In China. So I think there is a sense that initially that this was a very promising relationship that could be built and could last for a long time. I think it has proved to be a less stable company than initially thought. I think there have been people and analysts who have raised concerns over the years about how Evergrande was conducting its business, whether its accounting was appropriate and right. So I think now it is a struggling company. I think it is fair to say. I think right now there's, it got into all these businesses like bottled water, soccer, healthcare, and some businesses like healthcare it knew nothing about. So I think there's been concern about it grew so fast, and whether or not it was based on, the finances were there to support that growth.
Do Chinese corporations create a fancy illusion that ensures how promising it could be for U.S. entities collaborating with them? How far is it from reality?
I think there were some signs with Evergrande that businesses should have been concerned about. I think the question is how, there were analysts saying this company is perhaps a little more shaky than it should be. There was one analyst we spoke to who said, she had visited a lot of the buildings that Evergrande had built, and many of them were empty. And so she had raised concerns about whether or not this was a Ponzi scheme, So I think there were people who are kind of raising red flags about this company out there. Initially, there was this issue of the hospital project was built as, a 647-bed hospital, and there were questions about, how much marketing was done for the hospital. It seems like, at least in the work we did, that there was very little market research done by Brigham didn't do it, and they expected, I think, Evergrande to do it, and it's unclear whether it was done about whether or not the hospital would be able to attract patients, and that ended up being a problem because there were, from what we understood, only 10 patients at any one time in this massive, very fancy building of a hospital.
Speaking of contracts between large Chinese corporations and foreign entities, how deep could the Chinese government get involved?
We don't know that for sure. We aren't clear on it. We do know that one of the attractions of this hospital and this site was that the Chinese government was trying to create an area that was a medical hub on Hainan Island, and so that was part of the appeal, was that there was going to be some preferential policies there for medicine, like drugs that maybe not approved on mainland China would be approved on this island for use. So there was an appeal to be on this island because of some of the policies the Chinese government had been involved in.
Even at the beginning of the pandemic, Evergrande promised a big new project with Harvard. Do you think Evergrande could continue to deliver?
I think it is going to be hard for Evergrande to continue to deliver. I'm sure you're aware that they have a lot of debt. $300 billion, I think, is the amount of liabilities, and they're having a lot of difficulties in China. So I think at least the experts are concerned about whether Evergrande would be able to deliver even on the COVID money. I think the Harvard project is trying to move forward with the money they have received from Evergrande, but I don't think they're expecting much more.
Could you say Harvard may also get some lessons to learn from the multiple cooperation with Evergrande?
I think there's probably some issues about how reliable funders and donors can be. There's probably a promise of a lot of money, but there is a question of if they can deliver on those pledges of funding. The relationship with Evergrande was built at a time when Harvard was very eager, and a lot of universities were very eager to build relationships in China with wealthy Chinese donors. And I think many institutions, not just universities, but even the hospital, were trying to build those relationships. So the question is whether those relationships can last, how much they vetted these donors to see, how they were making their money. Because one of the issues with Evergrande was they had borrowed a lot of money to make and build up buildings and go into these projects. So, there is a question of how long that philosophy of business can last.
And do you think Harvard has guarded its reputation very well in its working with Evergrande?
I think Harvard is very specific about and very careful about where it lends its brand and its name. So I think they are very careful about where they can connect Harvard and the Evergrande group. For example, the Brigham Hospital had the Brigham name on the hospital with the Evergrande group's name, but Harvard's name wasn't on the front door, as to speak. So I think Harvard is very careful about how it uses its name and how its name is used.
Now that the collaboration with Evergrande didn't work, does it hurt Brigham, for example, their reputation as well?
That's a good question. I think there's a lot of questions that have been raised since we've written this story about whether or not, Brigham or any nonprofit hospital here in the U.S. Should be doing these projects overseas, especially to attract when these hospitals are aimed at wealthy patients. There's this question of whether or not they should just go abroad and just scoop up all the wealthy patients to subsidize healthcare here in the U.S. So I think there have been a lot of suggestions about whether these efforts, because Brigham isn't alone, there are other hospitals, Johns Hopkins, the Mayo Clinic. There are a lot of big name hospitals in the U.S. that have this approach of going abroad and catering to the wealthy in other countries. So I think there are questions about whether that is a worthwhile endeavor for hospitals that are supposed to be not-for-profit here in the U.S.
What could be the reasons that Brigham did not renew the contract with Evergrande last year? Do you consider it as a wise decision, or the contract wouldn't make much sense considering the trouble Evergrande is in?
Brigham says that the contract ended, and so they basically decided not to move further with their relationship. I mean, the timing helps is good for Brigham. There is a question about whether or not Evergrande would be able to fulfill any even future promises of future work there at the hospital. So the hospital still continues to exist and is a working hospital. It's still now it is taking also accepting the government insurance and trying to appeal to more patients. But I mean, the timing is interesting because Evergrande's problems have become so enormous now.